这个小头发。
So the motion, can I actually have that please? The motion that is performed at C0, C1. Okay, as you guys know, I love practicing consent and whatnot for the purposes of encouraging you to practice consent. But for the purposes of being able to breeze through this, I'm not going to go through every tidbit of consent because by now, hopefully, you'll be able to practice that portion. All right. So, Neil and I will have to work around your neck area. This can be a little bit sensitive. Please let me know if you experience too much discomfort or if you need to stop or change anything. Is it right with you if we work in this area here? That's okay? Awesome, thank you. Okay, so can I get you to step aside, please? Thank you. So for C0, C1, first things first, before we apply any corrections to the joint, we want to assess the joint. So we are going to assess their capital flexion and extension. So for assessing capital flexion extension, that is pretty limited. We're literally just trying to move. He's got more, but still quite limited. Assessing literally capital flexion. You'll notice I'm not flexing his neck. I'm literally just targeting those upper C-spine joints, and then also in extension too. He has more extension, so we're going to target capital flexion. Okay? So I'm going to go ahead and bring him into his capital flexion restriction, and I'm going to get him to try and contract against me. Now I'm not going to tell him to push his head back. This is a minimal contraction we are going to apply. So the only thing I'm going to ask him to do is look up towards me. And believe it or not, that will actually contract the muscles we're trying to target. So if he's in neutral right now and I just ask him in neutral, Neil, can I get you to look up towards me? Do you notice how muscles are contracting towards me? So that's the contraction we're going to utilize. Just like if I tell him, try and use your eyes to look towards your toes. And back up towards me. And then back down to your toes. You notice there's that little bit of movement that's happening. So those are the contractions we are going to use. Literally just use their eyes. Okay? So I'm going to bring him into the restriction, and he is going to contract to try and come out of the restriction. So if I'm bringing him into capital flexion, I want him to contract against me. Which motion am I going to get him to do? Look towards me or his feet? You. Correct. He's going to look towards me. So Neil, I'll get you to look up towards me. Hold for 5, 4, 3, 2, 1. Relax. Very good. Nice breath in. And when he breathes out, I'm going to go further. Good. And again, Yoan, look up towards me. Hold for 5, 4, 3, 2, 1. Relax. And good. Let it go. Let it go. Let it go. Good. And one more time, Yoan, up towards me. Hold for 5, 4, 3, 2, 1. Relax. Breath in. And out. Good. So I did that progression 3 times. Okay, we want to do it 3 to 5 times. As you're beginning, you might want to do it a couple more times if you feel like you're not being as effective. And then what's the last thing we want to do after we do correction?
Stretch.
Reassess. It says right there. All right, so we'll check out his capital extension. That one's always been good. And then we check out his capital flexion. See how much more movement that is compared to the first time I moved it? Right now his capital extension is actually reduced in comparison. So we'll actually target that one. So I'm gonna bring him into capital extension. Good, okay, Neil, I'll get you to look down towards your toes. Good, hold for 5, 4, 3, 2, 1. Let go, breath in, and out. We could get him to use his eyes to look up towards me to assist, but I like doing it entirely passively because sometimes I can't let go. Okay, again, look down towards your toes for 5, 4, 3, 2, 1. Relax, breath in, and breathe out. I take up as much slack as I can into extension. And then again, one more time, Yoan, down towards your toes. Hold for 5, 4, 3, 2, 1. Let go, breath in. And relaxing. And let it go, let it go. Good. And then we can go a little bit more. Good. And then what do I do after I've applied? Reassess. Good. I've got way more capital extension and way more capital flexion than what we saw at the beginning. All right. So any questions about that one?
What's the difference between this and P and F then?
Because PNF is targeting the muscles, I am stretching the joint. Yes, we are targeting the joint. All right, any questions about that one? Perfect, where's my remote? I put it down somewhere.
So you're trying to release the capsule of the joint?
Not releasing the joint capsule, no. I am bringing them into the restriction of the joint capsule, but the muscle contraction is causing the muscles around it to let go. So it uses the same principles of PNF, where the tissues will lengthen after it contracts, and that lengthening is what's gonna allow us to target the joint without the muscles trying to guard against it. Right? Because if we don't use the muscle contraction, then the muscles can just contract against us, meaning we will not be able to get in to target the joint. So it's very similar. It's just your intention of what you're trying to do is what's going to make it different. Good question. All right, again, if you're having troubles with these, don't worry. We're going to be revisiting these throughout the term as well, too. All right, now we are doing cervical flexion rotation. All right, so this one, super, super nice and easy. Okay, so with this, it is literally a continuation of our cervical flexion rotation test. So the first half is exactly like our cervical flexion rotation test because we need to assess. So we're gonna bring our patient all the way up into full flexion. Good. And then we're gonna go ahead and assess in rotation, and that's a nice 45. And then go ahead, take a breath. There we go. Make sure you give him a second to be able to breathe. Good. We're gonna go into full flexion again, and try and rotate. So he was actually more restricted towards the other side. So we will target that one then. Yeah, right there. Okay, so that is where our restriction is. So that is where we're gonna perform this MET. Okay, so I'm gonna bring him into that position. I'm gonna bring him all the way over to the restriction. And then since he has to try and contract into my force, which way am I gonna try and get him to move? Back to neutral. Right, so I'm gonna bring him into rotation. I'm gonna tell him to try and turn his head back to neutral using minimal power, and I'm going to resist him. Okay, so this is what it's gonna look like. I'm gonna bring him into the restriction, full flexion. I'm gonna bring him into this restriction. We're actually challenging it, so it's a little bit better now. Okay, Neil, I'll get you to go ahead and try and turn your head to neutral. Hold for 5, 4, 3, 2, 1. Relax, breath in. And when he breathes out, we're gonna go even further. Good, Neil, go ahead, try and rotate. 5, 4, 3, 2, 1. Let go, breath in and out. Good. So I didn't want to do it 3 to 5 times because we were already nearing that end range of what should be available. So then what's the next step? To reassess. Good, so let's go ahead and try the other direction first so we can see comparatively how easy it goes. That one's going nice and easy. Let's try the other direction, the direction that was restricted. It's like even the start of the movement is way more free moving. That feel okay? Good. All right, so again, I would normally apply that 3 to 5 times depending on how much restriction there was. Questions about this one? Good. Excuse me, please, ma'am. Yes, thank you. All right, so this is the one that you guys have been practicing for with your assessing inflection and extension. All right, so this is the one that's got 3 degrees that we're talking about. So for the sake of making this a little bit easier for you guys to practice when you review these videos, we're gonna assess his upper cervical spine because that requires the least amount of movement of the neck in order to engage the restriction properly, okay? We're gonna start with flexion and then we're gonna follow with extension, okay? So what's the first thing we wanna do before applying this MET? Assess. The very first thing that it asks for is for us to assess. So that means I'm going to landmark on C2, C3. I'm going to bring him into flexion so that I feel that top segment move, but that bottom segment stays nice and relaxed right there. I'm gonna go ahead and landmark. No, I'm not doing translation, so I don't have to do that. Great. Okay, back up 1 second. Okay, we're gonna landmark 2 fingers on C2 and C3. We are going to bring him into flexion until we feel that segment move. And I'm gonna go ahead and assess. So I guess we are doing translations. Okay, he very stuck on this right side. So right side it is. So he has a restriction on this right side in flexion, which means he has a dysfunction in flexion on the right side. So we're gonna try and open that facet. So I'm landmarking on C2, C3 again. I'm gonna flex until I feel that top segment move. Drop your head, don't help me. Good. Good. Once he's gone that far, am I gonna move towards the restricted side or away from the restricted side for flexion?
Away.
Away. Away, away, away. You got it. So then still landmarking on 2 and 3, I'm going to laterally flex until I feel that top segment keep moving, but the bottom segment hasn't. Good. And then rotation towards or away?
Away.
Away. We're gonna rotate away once again. I'm still landmarking C2, C3, and I'm gonna rotate until I feel top segment move, but bottom segment hasn't. Okay, so we can landmark here. Neilin, I'm gonna get you to go ahead and apply 3 directions in the opposite direction. So for this, I tell my patient, go ahead and gently try and extend backwards, try and flex back to the middle, and try and rotate. Good, hold for 5, 4, 3, 2, 1, relax. And when he relaxes, I go a little bit further into flexion, a little bit further into lateral flexion, and a little bit further into rotation. Good. Okay, try and push backwards and rotate and laterally flex the other way for 5, 4, 3, 2, 1. Relax, breath in. And breathe in and out. Further flexion, further lateral flexion, and further rotation. Good. So that is literally it. So now I'm gonna go back, landmark on C2, C3. I'm gonna bring him into flexion until I feel that segment move, but not the one below it, and then I'm going to reassess. I got way more movement happening now, more on that right side. Okay, so the exact same thing would be had for extension, where we would assess the patient this time in extension. So landmarking C2, C3. I'm going to start with slight capital flexion and then slight capital extension. Keep going until I feel that top segment tuck under. Keep going until that second segment starts to tuck under, and I back off just a little bit because I only want that top segment to be moving. After that, I'm going to assess, right? Now, apparently he's stuck on this right side. Honestly, it's because he has rotated vertebrae. We already know this. So ideally, I'd correct the rotated vertebrae, but we aren't there yet, so we're just going to deal with the facets. So we've identified the restriction is on the right side. So once again, I'm going to landmark. I'm going to go ahead and bring him into extension until I feel that top segment move right there. And then since his restriction's on the right and we're going into extension, am I going to have him side bend to the left or to the right? For extension. Towards the right. Towards. So then I'm going to laterally flex him towards the right side until I feel top segment move, bottom segment stay stationary. And then rotation towards or away? Towards. So I'm going to go ahead and slowly, gently rotate his head until I feel the top segment move right there. Second segment, or I guess third segment, is not moving. And then I will hold it here and kneel in. I'll get you to go ahead, try and gently flex forward, and then try and turn and flex your head to the center. Hold for 5, 4, 3, 2, 1. Let go, breath in. And when he breathes out, I'm gonna go a little further into extension, a little bit further into lateral flexion, a little bit further into rotation. Good, go ahead and those 3 directions again for 5, 4, 3, 2, 1. Let go, breath in. And out. Extension, lateral flexion, and rotation. Good. In terms of the correction itself, I personally think that extension is easier because it's bringing the segments closer together, and it's a lot easier to jam them together than it is to try and pry them apart. So in terms of assessing, I find flexion easier, but in terms of applying the correction, I find extension easier. Okay, so bringing him back into extension, and when we reassess, still a little stuck, but we've got more movement. Again, it's probably because he's got a rotated neck. most likely. All right, any questions about those MUTs?
How do you know how much further you go? Because the first movement you move until you don't feel that top vertebrae anymore, but then how do you?
Minimally. So you're just gonna have to wing it at this point.
Oh.
Yeah, because you're gonna be feeling the restriction, but at this point you might not be able to palpate for those restrictions, right? So at this point, probably just gonna pretend you feel the restriction, so you just go minimally. So, recap, muscle energy technique. You bring them into the restriction, you get them to try and flex out of it, they relax, and you go further into the restriction. Okay? All right. And in terms of time, 5 minutes. Great. Well, feel free to go ahead and practice a little bit. If you like, Neil and I will be around for a whole 5 minutes. I technically have until 4:15, but I can't stay any later than that because I have an appointment downstairs. But if you would like to practice and need some feedback, I will still be here for a little bit.